even if Omicron establishes itself and causes large epidemics around the world, we hope it will take a couple of months at least. And this period of a couple of months gives us valuable time to understand this variant, find out more about it, and put in place the appropriate countermeasures. During this time, we may see sporadic cases slipping through into our borders, and we want to be able to detect, isolate, and contain these cases. What we want to prevent and need to prevent during this discovery period is to prevent Omicron to establish itself in our community. We will run parallel healthcare protocols, one for the known Delta and the other one for the unknown Omicron. The first is to coexist, the second is to contain. First, quickly establish our starting point. So far, indications is that we do not have any Omicron infections in Singapore yet. We will continue the current healthcare protocols for Delta. As for Omicron measures, the healthcare protocols will be a lot stricter and quite similar to the initial protocols we implemented when we first encountered COVID-19. And everyone will be quite familiar with those protocols. There is a particular PCR test that we have, supplied by Thermo Fisher, which goes beyond identifying a person as being infected by COVID-19. It can also indicate if the person is likely to be infected by the Omicron variant, because this is a particular difference in the gene dropout. So we will prioritize this particular PCR test on travelers. So if an individual is suspected of being infected by Omicron, he will be admitted to NCID. And if confirmed, will be managed there until we are confident that the person is non-infectious through repeat testing. There is no option of HRP for this group. We are also standing up dedicated isolation facilities for Omicron as a further option if we feel that public health considerations justify this. And with every Omicron positive case, we will do what is familiar to everyone. We will conduct full contact tracing. Contacts will then be placed under quarantine and tested with PCR for exit.